Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 3rd of March 2021. And the picture really is one of a progressive improvement as far as our COVID numbers are concerned. So today we're showing 36 positive patients who are within 14 days of their first COVID positive diagnosis. That compares with 57 this time last week. There's one patient in Clifton, 29 on our general wards and 6 in our critical care unit. If we add that to the number of patients who are in hospital because of COVID but are now beyond 14 days, and sometimes the length of stay is quite long for patients who are poorly with COVID, we get to a figure of 103, and this time last week it was 128. I'm sorry to report 31 additional deaths of patients who are within 28 days of a positive diagnosis over the last week, and that brings the total to 746 since the start of the pandemic. We've still got 24 critical care beds open, and I've mentioned before that our normal complement of critical care beds is 16. So we are still in what's called surge or super surge. If you remember, we had 32 open at the very peak of COVID, middle of January really, in terms of this third wave. We're gradually bringing those levels down as we can with the ambition to get back to 16, but it looks like it's going to be a few weeks before we get there. As we do reduce our critical care beds back down to normal, that means we can put more teams back into some of our more, if you like, complicated surgical work and cardiothoracics and so on. So we gradually build that up as the critical care demand comes down. In terms of community numbers, we're seeing progressive improvement. Nice to see the figures in double figures rather than triple figures for the first time for such a long time. So for Blackpool, per 100,000, we're showing 80 compared to 131 last week. For Fylde, it's 109 compared to 129 the week earlier. And for Wyre, it's 77 compared to 112 a week earlier. And we're seeing a really continuous and encouraging reduction in positivity rates in the over 60s, which of course we believe is in no small part due to COVID vaccination programs. And so as ever, I absolutely urge you to get your COVID vaccination if you haven't done yet, and the at-risk group list keeps progressing, so you'll be getting calls from your GPs as we're now in the over 50s age group, and that will keep progressing as we move forward. Within the hospital, we've done over 17,000 vaccinations now, mostly of the Pfizer-BioNTech vaccine, and we are now doing second vaccinations for our staff and for those people who had their first vaccination with us towards the end of December and January. I think the recent published data has been compelling, hasn't it, about the effectiveness of a single vaccine, so that's been really good, but of course it's really nice now to be doing the second vaccines for everybody. At the same time, it's clear that new cases of COVID are still occurring. So if you do feel you have flu-like symptoms, essentially, we've still got lots of testing capacity. And as I've said before, you can get a test by dialing 119 or NHS 111. As our COVID numbers have come down, we're still really very busy. We're seeing a lot of patients coming in through accident and emergency. Some days we have over 100 ambulances coming to the department. So we're seeing a lot of poorly patients, and it might be this is a sort of a shift as a consequence of the COVID numbers coming down, but people having been staying away for perhaps too long. So I'd certainly say if you do feel your health conditions are deteriorating, please get in touch with your GP services. And if you have a problem which is urgent but not an emergency, before coming to our ED department, please will you either dial 111 and discuss it with that service, or talk to your GP practice first. Schools, of course, are going back on Monday. And I'm sure we are excited and very hopeful about that. It's an important part of our moving forward. I suppose it exposes a new risk now in terms of possible increase in infection rates. So if you are taking your children to and from school, please maintain social distancing and be careful at the school gates and so on, and thoughtful of the new interactions that are going to occur as our children go back to school. I'm sure we all support that initiative, but we still need to stay vigilant with our usual hands, face and space messages. Now is not the time really to back off from that vigilance, I think. And finally, there's a lot being said in the media around long COVID, this condition which can manifest itself in quite a lot of different ways as a post-viral infection syndrome after COVID. And we have established a clinic within the hospital managed by a multidisciplinary team to address the needs of patients who have developed long COVID. And important that all of our GP colleagues are skilled up in recognising the signs of long COVID and making referrals appropriately. So if you feel you are suffering the ongoing symptoms of an earlier COVID infection, I'd urge you to get in touch with your GP practice and be aware that there are referral pathways now in place to help you. So thank you very much as ever. Please stay safe and look after yourselves and everyone else. Thank you.